Hey everybody, and welcome to Module 3, ACT. The first action step we are going to take when we know someone is potentially experiencing an opioid overdose is call 911. We need emergency medical service and law enforcement to come to the scene to further assist us and the person that needs help. Do your best to remain calm. It is going to be somewhat of a frightening situation if you've never experienced something like that before, but do your best to stay calm and relay important information to the operator. I have an unresponsive person at 123 West Street. I need an ambulance. And they may ask you other questions or stay on the line with you. Just do your best again to remain calm. ACT. Our next action step is administer naloxone or Narcan. Here I have Narcan in a package. I just want to show you guys what it looks like. Okay, so step 1, peel back the package. Place a pointer finger and a middle finger on either side of the plunger and your thumb on the plunger. Now this is a demo device that I'm using. Next, you're going to place the nozzle in either nostril until your fingers touch the bottom of their nose. So my fingers are touching the bottom of my nose. Now press that plunger firmly into their nose, and that's what releases the Narcan or naloxone into their nostril. So you'll notice that plunger has disappeared. We will talk about this several times, but the intranasal device are one-time use. So once you push that plunger up, there is no naloxone left in this device. It is now trash. You may repeat administering naloxone every 2 to 5 minutes. Remember, you'll have to have a second device and to switch nostrils. So that time I did my left nostril. If I needed a second dose of naloxone, I would use my right nostril. Again, each device is one-time use. Please remember that Narcan needs to be stored at room temperature or refrigerated between 36 to 77 degrees Fahrenheit. What does this really mean? Please don't leave it in your car during summer months where it gets over 100 degrees, or in your car during winter months where it is frigid temperatures. Also protect it from light. Now, keeping it in this original packaging should be okay. ACT. The next part of our action steps is rescue breathing. Now, we are only going to do this if the person is breathing extremely shallow or not breathing at all. If a person is able to maintain their airway and take adequate breaths, we will not have to perform rescue breathing.
How to respond to a suspected opioid overdose and administer naloxone. Signs of an overdose are unconsciousness, fingernails or lips turning blue, slower, shallow breathing. Immediately call 911, report location. If overdose is suspected, try rousing them verbally. If this doesn't work, vigorously grind knuckles into the sternum. If no response, make sure the airway is clear. Administer 1 dose of naloxone. If they don't respond within 2 minutes, administer the second dose. If no response, get them to a flat surface, provide rescue breathing. Tilt head back, pinch the nose, and put your mouth over there.
Okay, so as we can see, There are several steps to rescue breathing. Step 1, lay them flat. Do a little bit of a head tilt, chin lift. Now that might sound difficult, but the point is you want to keep their head and neck neutral. So just open airway. Because if I'm hyperextended like this, or down like this, that airway's not open where the air can move through it into their lungs. Next, you're going to place a protective barrier. In this photograph here, there is no protective barrier. However, we do suggest that you have a one-way valve type system where you place the plastic over the person's mouth. That way you blow air in, but anything they may have coming back at you will not get on you. Then you're going to pinch their nose shut. You yourself take a big deep breath, seal your mouth over theirs, and then blow into their mouth. When you do this, if you angle your eyes just right at their chest, you should see some chest rise. Repeat this step approximately every 5 to 6 seconds. As we've discussed in previous modules, you and I breathe approximately 12 to 24 times a minute, depending on what we're doing. So don't make yourself lightheaded. Don't make yourself short of breath. Any breathing is going to be more than what they were doing without you. So you don't have to get out your stopwatch to keep track of every 5 to 6 seconds. But just, make sure you're breathing, but make sure that you're also giving them adequate breaths too. Okay, we are going to do a knowledge check. Each intranasal naloxone device is good for blank dose. I hope you said 1. Intranasal naloxone can be given every blank minutes as needed based on symptoms. 2 to 5 minutes. 3 key signs and symptoms of an opioid overdose include blank, slow or stopped breathing, and blank. Decreased alertness, pinpoint pupils. So remember, decreased alertness, pinpoint pupils, slowed or shallow breathing. Those are 3 key signs and symptoms of an opioid overdose. Blank priority is number 1 for safety. Safety is the number 1 priority for who? For what? For you. Remember, we want you to be part of the solution, not part of the emergency. How do we do this? Scene safety. Wearing gloves if you have them. Using that protective shield if you have one. Give a breath every blank seconds during rescue breathing. Every 5 to 6 seconds. Remember, you don't have to sit there and look at your watch and count out seconds. It's going to seem like an eternity before EMS and law enforcement arrive, probably. So do your best to stay calm, breathe so you're not lightheaded, and give them breaths accordingly. Okay, that is the end of ACT. Thank you.